you're getting an exclusive look at an NFL training facility. It's been essentially a ghost town here since March. But training camp is now about to begin for the Atlanta Falcons.
There's a real schism, Alan. There's some people who says, here's what you do, here's the plan. And there's other people who say, it's absolutely ludicrous to even try this. The country is in the middle of a pandemic. Football's great, but you got to sit this season out.
Yeah, I think people are trying to be really thoughtful about this, and I think people do look at risk and risk mitigation in different ways. But I feel like it's the right thing to do to try to learn to live with this virus.
Dr. Alan Sills is Chief Medical Officer for the NFL. We're both neurosurgeons, and we've known each other for several years.
Can we find ways to do that safely? That's our challenge.
The last NFL game was February 2nd of this year. Super Bowl 54, the Chiefs beat the 49ers 31-20.
2 days earlier, the U.S. declared a public health emergency because of coronavirus.
Since then, millions of people have become infected, more than 140,000 have died, and now the NFL wants to do the seemingly impossible: bring back some sense of normalcy to one of the largest sports leagues in the country.
Some of the changes indoors are going to look very familiar. Lots of masks, near constant sanitizing, and physical distancing everywhere. Treatment rooms, weight rooms, even mealtime, and on the field.
There are actually 3 regulation-sized football fields here side by side. So first thing that jumps to your mind is how we can do physical distancing here, right? So as players start strength and conditioning activities, for example, you're talking about each individual or each very small group having a lot of space to work with.
There will even be this new space-age looking technology, a bubble of sorts for those who want it.
A number of our players have worn eye shields over the past years for protection or for performance reasons. So it's basically an extension of that device, but it's a multi-layered device so that you've got ventilation holes and you've got some filters in it.
There are these proximity tracking devices that will beep or flash when players or staff get too close to one another. And then that data is collected, making contact tracing easier if someone does become infected. Now, unlike the NBA bubble that's isolated the entire league in Orlando, the NFL has more of what they call an ecosystem. People will still live in their own homes, they'll be with their own families, and they will travel with their teams for games.
Players, coaches, staff, if they're around each other each day, they're going to share risk. They also share responsibility to each other, which means that they're each making good choices when they're away from the facility. All around the building are...
But that also means the entire ecosystem is only as strong as its weakest link.
How are the players doing? Are they worried? Is there a way to describe the mood?
I would say, yeah, sure. They have the same anxiousness that you would have.
Rich McKay is CEO of the Atlanta Falcons.
They're relying on us, and they're relying on the union to make sure that all the protocols we do, everything that we can, is done at the highest level that we can.
Everything that we do is going to have an impact on families at home, and it's going to have an impact on first responders, community service, and other people in the community. And to believe otherwise is sheer fantasy.
DeMarie Smith is executive director of the NFLPA. That's the union representing players on the field this year. There have been some pretty tense negotiations between the union and the league about how to play in the age of COVID-19. And Smith pointed out something that I hadn't heard before. About 70% of NFL players could be considered vulnerable themselves or at increased risk.
What we've done is tracked the CDC risk guidelines, made decisions on which ones put our players in high risk, and players can rely on those risk factors to make decisions about whether they're going to play or not.
I was actually surprised by that, because you think of athletes just being these superhuman, sort of perfectly healthy people, but there are these various conditions. How does that play into your thinking?
We still do not know a lot of the basics about this disease and where it's going to be headed. And I think it harkens back again to those conversations that each individual has to have, and they have to, in their mind, make what's the best decision for themselves. And this is where they would come in for testing.
The league and the union have agreed to test every player daily for at least the first 2 weeks of training camp. eventually moving to an every other day schedule once a team reaches a 5% positivity rate and then maintains that.
Does that make sense to you? Because there is an incredible shortage of testing right now. And we did some rough math, and if you look at the testing plan here, it's about, just for the players, about 18,000 tests per week. I mean, how could that not have an impact on the availability of more widespread general testing?
Clearly there are procedural issues with that around the country. So we went with a company that was outside of market that would have a national platform. They actually opened up some laboratory capabilities that weren't being used just for this project, and also set up, again, supply and distribution and testing reporting that's completely separate from any healthcare work that they do. And that company has given us their assurance that any work that they do for healthcare applications, meaning for hospitals, for emergency rooms, things of that nature, that's a whole separate business for them that will remain their #1 priority.
Did you ever think, look, maybe this season's going to be a wash. We'll get back to it next year, but this isn't essential. As much as I love football, this isn't essential compared to the essential things that are needed in the country?
Yeah, I would say that probably those thoughts went through your mind 3 months ago. I think as we moved forward and we saw that hey, basketball is going to do this, baseball is going to do this, soccer is going to do this, we get to go last, we can learn from them, we can do this in a really safe way, we think. And so I think for us, we got the message that people wanted football. That's not the reason to play, that people want it. But if we can do it in a way that is as safe as it possibly can be, then we should, and we will. And that's what we're going to do.
Dr. Sanjay Gupta, CNN, Flowery Branch, Georgia.